everybody, this is my second vlog for Informatics 645. And this week we were asked if we were having a procedure, a non-invasive procedure at a teaching hospital, would we be comfortable allowing the resident or the fellow to perform the procedure under the physician's instruction? So if I was a patient having back problems, and before the physician does invasive surgery on my back, he wants to try a chiropractic adjustment, something non-invasive like that. Would I allow the resident or the fellow to complete the procedure? My answer to this question is that I would, simply because I know what it's like to be a student and be in the position where I'm learning in my field, and I personally do better with hands-on experience and learning the procedure by actually doing it instead of someone just showing me how to do it or doing it and letting me watch. So I know from personal experience that I yield better results when I'm hands-on and I have that experience. So I would allow the resident or the fellow to perform the procedure just because of that reason. And I know many others like myself learn better in hands-on situations. It also asks if the case comes where I wasn't comfortable with the fellow or the resident performing the procedure, and the physician told me that that's their policy, and whether I'm okay with it or not, the resident or fellow will complete the procedure anyway. Would that be a legal issue for the hospital? I definitely feel like it would be a legal issue for the hospital because if anything was to happen, although it is a non-invasive procedure, anything can happen. And if anything was to happen under the resident or the fellow completing the procedure, it would be on the hospital. And if I went in and I said to them, no, I'm not comfortable with the resident or the fellow doing the procedure, I'm not absolutely against it because I haven't walked out, but I'm saying to them I'm uncomfortable with it, and the physician is adamant about, regardless of whether I'm comfortable or not, it's going to happen that way. Then if something was to go wrong and I come back and say, well, I was against it anyway, then that could be a legal issue for the hospital because I could sue saying that I expressed to the physician that I was having some hang-ups about the resident or fellow, and I would rather the physician go in and do it, but not necessarily against my will. But technically, the physician said either way, the resident or the fellow would do it. The category that this falls under legally would be liability. It will be medical liability because it has something to do with the physician and them performing a procedure, a medical procedure, and technically they're the ones who are supposed to be liable for the procedure, so it would fall under the medical professional liability because I could look at it as an issue of malpractice because I expressed that I was uncomfortable with the resident doing the procedure. So in my mind, the physician was negligent because I expressed how uncomfortable I was, and they basically told me that whether I was uncomfortable or not, unless I walked out, the resident or fellow would be the one doing the procedure. And it also has something to do with my consent because technically, unless I was informed beforehand, I gave consent to the physician to do the procedure, not necessarily to the resident or fellow to do the procedure. So I gave consent to one person, and it's like though that person will be in the room, another person is technically performing the procedure.